All right, well, coming up, it's National Prematurity Awareness Month, and where do you think New York ranks in keeping moms and babies healthy? Next at noon, the new March of Dimes report highlighting what they're calling a maternal and infant health crisis. Welcome back. November is National Prematurity Awareness Month, and today, March of Dimes has released its annual report card about the health of moms and babies in preterm birth. It includes some shocking statistics. For example, for the fourth year in a row, the rate of preterm early births is increasing in the U.S. So joining us to talk more about all of this is Dr. Raul Gupta. He's of course, the Chief Medical Officer of March of Dimes. Doctor, thanks so much for being here.
Thanks for having me.
So those numbers seem scary, right? For the fourth year in a row, it's getting worse, not better. Were you shocked by that finding in your report?
Well, it certainly concerns us greatly that for the fourth year in a row, we're having a preterm birth rate that has now crossed 10% mark.
So I want to show a map that you guys put out, and this is all around the country, the state by state, and purple is an A, and you can see if you look at that map, there's only one state that's purple, that's Oregon. The rest are all below an A. Why is there only one state? And I guess first explain what preterm births are and then why only one state is doing good at it.
Well, preterm birth is basically when you have a baby before 37 weeks of gestation. And there could be late preterm birth where we're seeing a lot of increases, which is between 34 and 36 weeks especially. These preterm births have a more association with poor outcomes. So we're talking about where kids were born, have problems with breathing, low birth weight, could have other problems growing up, as well as lots of problems with behavior as well in the future.
And is that why preterm is a good indicator? Because it kind of, if there's a preterm birth, that means other things could be the problem?
Yes, including the health of the mom. And one of the reasons is going up, and you see only one state in the nation with a grade A, really it's A minus, is because we're falling behind as a nation, and we need to do more. We've rated a whole country as a C, which is not good.
And the numbers are even worse for women of color. In New York, the preterm birth rate among black women is 48% higher than white women. Why is that?
Yeah, so one of the things that is significant, persistent, and very troubling to us is that these racial, ethnic, and socioeconomic disparities that exist across the nation, that's really plaguing us. And part of that's because a number of factors, but it includes a lot of racial biases, as well as institutional and structural racism that occurs. Just in the way the care is provided matters who you are. Race becomes a pre-existing condition. It should not be when it comes to health care.
And you think of New York City, the numbers are getting worse specifically here in the city as well. I mean, you think we're a place with all these world-class hospitals and world-class health care, but we're not immune from that either.
Yeah, if you compare to last year in New York City, we're a tiny bit up, meaning worse. There's a lot, though, we can do today, especially in terms of population African-American women. So there's these disparities that exist that really aren't fair, and they cannot be justified, seriously.
And your March of Dimes is calling for some specific action that you want to see governments do, right?
Absolutely. We think that about half of the nation's births are covered by Medicaid. New York has done a great job in expanding it. We think that we should extend the postpartum care to about 1 year after postpartum. We should not kick women off the rolls. We also think that all the hospitals, through legislation, should have community advisory committees. So we actually, people who seek care should also have a voice in the quality of care that's been provided.
And then finally, just to close out, if a woman's watching who is pregnant or thinking of becoming pregnant, what's the advice to moms?
I think the important thing is get ready before you get pregnant, meaning watch your weight, make sure your diabetes, high blood pressure is under control. While you're pregnant, make sure you're getting good care, but also watch for other things like stress in pregnancy. Group prenatal care is something we call supportive pregnancy care that is working very well, has shown good outcomes, and we really think March of Dimes is moving forward with that. And then postpartum care, watch your mental health, watch substance use. Those are some of the biggest drivers after delivery.
All right, Dr. Raul Gupta, thanks so much for being here.
Thanks for having me, Joe.